Certified Nursing Assistant Test Prep. Question 1. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B. Weigh the client at the same time each day. Weighing at the same time each day, example, before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 2. The RACE acronym stands for: Option A, rescue, alarm, contain, extinguish. Option B, run, alert, call, evacuate. Option C, rescue, assess, control, evacuate. Option D, remove, alert, contain, extinguish. The correct answer is option A. Rescue, alarm, contain, extinguish. RACE is the standard fire response protocol: rescue clients in immediate danger, alarm, pull the fire alarm/notify, contain the fire, close doors, and extinguish, if safe. Question 3. What factor is not known to affect vital signs? Option A, pain. Option B, age. Option C, hair color. Option D, exercise. The correct answer is option C, hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 4. A client is pacing and appears anxious. The nurse aide should: Option A, ask the client to sit down. Option B, walk with the client. Option C, give the client a sedative. Option D, leave the client alone. The correct answer is option B, walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 5. A client with dementia becomes aggressive. The nurse aide should: Option A, restrain the client immediately. Option B, remove themselves from the situation and seek help. Option C, yell at the client to stop. Option D, ignore the behavior. The correct answer is option B, remove themselves from the situation and seek help. Aggressive behavior in dementia may indicate unmet needs or pain. The aide should ensure safety, step back, and seek help. Restraint requires an order. Yelling escalates behavior. Ignoring is unsafe. Question 6. When measuring blood pressure, the nurse aide should place the stethoscope over which artery? Option A, radial artery. Option B, brachial artery. Option C, carotid artery. Option D, femoral artery. The correct answer is option B, brachial artery. The brachial artery, located in the antecubital fossa, inner elbow, is the site for auscultating Korokov sounds. The radial artery is used for pulse counts. The carotid and femoral arteries are not used for routine blood pressure. Question 7. The chain of infection includes: Option A, pathogen, host, transmission route. Option B, air, water, food. Option C, bacteria, viruses, fungi. Option D, skin, blood, mucous membranes. The correct answer is option A, pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example, hand hygiene breaks the mode of transmission. Question 8. When providing care to a client with dementia, the nurse aide should: Option A, maintain a consistent routine. Option B, change the routine daily. Option C, avoid eye contact. Option D, speak quickly. The correct answer is option A, maintain a consistent routine. A consistent routine provides structure and reduces confusion and anxiety. Changing the routine daily increases agitation. Avoidance of eye contact and speaking quickly are not therapeutic. Question 9. A client is grieving the loss of their spouse. The nurse aide should: Option A, tell them to move on and focus on their health. Option B, listen and acknowledge their loss. Option C, avoid mentioning the spouse to prevent sadness. Option D, suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 10. What is the first sound heard through the stethoscope when taking blood pressure? Option A, diastolic pressure. Option B, systolic pressure. Option C, pulse pressure. Option D, pulse deficit. The correct answer is option B, systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 11. A client with depression refuses to get out of bed. The nurse aide should: Option A, allow the client to stay in bed. Option B, gently encourage the client to get up. Option C, force the client to get up. Option D, call the family to get them up. The correct answer is option B. Gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 12. When using a manual blood pressure cuff, the nurse aide should inflate the cuff. Option A, to 100 mmHg. Option B, to 150 mmHg. Option C, to 180 mmHg. Option D, 30 mmHg above the estimated systolic pressure. The correct answer is option D, 30 mmHg above the estimated systolic pressure. The cuff should be inflated approximately 30 mmHg above the estimated systolic pressure, determined by palpating the radial pulse while inflating. This ensures adequate occlusion. Fixed numbers don't account for individual variations and could be insufficient or excessive. Question 13. The proper body mechanics for lifting includes: Option A, lifting with the back. Option B, lifting with the legs. Option C, twisting while lifting. Option D, lifting with arms extended. The correct answer is option B, lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 14. The family of a dying client is upset. The nurse aide should: Option A, ask the family to leave. Option B, offer support and a private place to talk. Option C, ignore the family. Option D, tell the family everything will be fine. The correct answer is option B, offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 15. How should the nurse aide shave a client who takes blood thinners? Option A, with a straight razor. Option B, with an electric razor. Option C, with a safety razor. Option D, the same as any other client. The correct answer is option B, with an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 16. The pulse deficit refers to the difference between: Option A, apical and radial pulses. Option B, systolic and diastolic pressure. Option C, radial and carotid pulses. Option D, brachial and femoral pulses. The correct answer is option A, apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 17. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 18. The nurse aide is performing perineal care on a female client. The aide should: Option A, wipe from front to back. Option B, wipe from back to front. Option C, wipe in circular motions. Option D, wipe in any direction. The correct answer is option A, wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 19. A client with Alzheimer's disease becomes agitated when the nurse aide enters the room. The aide should: Option A, leave and return later. Option B, approach slowly and speak in a calm, soothing voice. Option C, ask the client what is wrong. Option D, call for assistance. The correct answer is option B, approach slowly and speak in a calm, soothing voice. A calm, slow approach reduces agitation. Leaving may reinforce the behavior. Asking what is wrong may be too abstract. Calling for assistance may be needed if the client is a danger to self or others. Question 20. A client who is confused becomes agitated. The nurse aide should: Option A, give the client a sedative. Option B, remove the client from the situation. Option C, use a calm, reassuring voice. Option D, tell the client to calm down. The correct answer is option C, use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 21. A client with mental health issues is refusing medication. The nurse aide should: Option A, force the client to take the medication. Option B, report the refusal to the nurse. Option C, hide the medication in food. Option D, tell the client they will get worse. The correct answer is option B, report the refusal to the nurse. Medication refusal should be reported to the nurse. Forcing, A, or hiding medication, C, is unethical and illegal. Threatening, D, is not therapeutic. Question 22. The nurse aide should document care. Option A, at the end of the shift. Option B, as soon as it is completed. Option C, before providing care. Option D, only if the client's condition changes. The correct answer is option B, as soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 23. When a client expresses a spiritual or religious concern, the nurse aide should: Option A, offer to contact the hospital chaplain or the client's clergy. Option B, provide personal spiritual advice. Option C, tell the client to pray about it. Option D, change the subject. The correct answer is option A, offer to contact the hospital chaplain or the client's clergy. The nurse aide should support the client's spiritual needs by offering to contact a chaplain or clergy. Personal spiritual advice is outside the scope of practice. Dismissing spiritual concerns ignores holistic care. Question 24. When counting respirations, the nurse aide should: Option A, tell the client they are counting breaths. Option B, count while appearing to take the pulse. Option C, count for 10 seconds and multiply by 6. Option D, count for 30 seconds and multiply by 2. The correct answer is option B, count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 25. The nurse aide's primary scope of practice includes: Option A, performing sterile procedures. Option B, inserting urinary catheters. Option C, assisting with activities of daily living. Option D, administering medications. The correct answer is option C, assisting with activities of daily living. The nurse aide's primary role is assisting with ADLS such as bathing, dressing, toileting, feeding, and mobility. Sterile procedures, catheter insertion, and medication administration require licensed nursing staff.